Future of Money, Governance, and the Law is hosted by the Government Blockchain Association, a worldwide community to connect, communicate, and collaborate. This show is produced by Podtex. To learn more and how to host your own show, go to www.podtex.com. Podtechs. Podtex, your partners in podcasting.
Hi, this is Gerard Daché. I'm the Executive Director of the Government Blockchain Association. And today we've got an awesome panel. We're going to be talking about ethics. So we have with us today Dr. Ingrid Veselou-Feltes. She is the ethics officer for the Government Blockchain Association. And she's just got a very, very sort of strong background in the ethics community. She also is the national or the U.S. Lead for the World Blockchain. The World Business Angel Investors Forum, and she's just got an incredible background. I want to let her fill you in. She teaches ethics courses for GBA and globally, and just incredible stuff. Reed Blackman is the founder of a ethics consultancy called Virtue. He also is he's on the AI advisory board for Ernst & Young, and a philosophy professor. And then Marquis Allen, he leads the GBA Healthcare Working Group. He's got a consultancy. He's got roughly about 20 years of healthcare and IT experience, and all three of these guys, or three of these folks, I'm just so pleased that we have today talking about ethics. So with that, I'm going to ask each of you guys to tell me a little bit about yourself and what you plan on talking about today, and why you think it's important. So Ingrid, let me start with you, and then we'll go to Marquis, and then Reed.
Well, thank you for inviting me. It's a pleasure to be on the podcast, and I have the highest experience in healthcare, but over the past few years, I consider myself a globalist and a digital advocate. I enjoy my ethics role as part of the GBA very much. And additionally, I also serve in the World Business Angel Investment Forum, where I'm part of the global startup efforts as well as the ethics committee. On a more academic and faculty level, I also teach business technology, and I am a big advocate to incorporate ethics into everything that we teach from undergraduate to graduate level, because I think digital advocacy and ethics advocacy early on is very important for our success long term. And that's pretty much it.
Excellent. Marquis?
I think that's just scratching the surface for Dr. Veselou-Feltes. Gerard, thanks for inviting me, and thanks for having me amongst this austere and auspicious panel of experts. I know Dr. Blackman and Dr. Veselou-Feltes, and we've spoken about ethics and had some really interesting conversations on the topic. But anyway, I'm the CEO of a company called Clinical Squared Incorporated. We're a multidisciplined healthcare technology and solution development company. I also serve as the Healthcare Working Group chair for the Government Blockchain Association. In my spare time, I also participate as an appointee to the Financial Services Regulatory Sandbox and Innovation Council in Washington, D.C. And, I've always been interested in technology, especially as a kid. And so having the opportunity to work with innovative technology and help the space grow, particularly when it comes to healthcare technology, has been a good fit for me.
Excellent. And then Reed?
Yeah, so again, thanks for having me. Really looking forward to the conversation. So my name is Reed Blackman. I'm the founder of Virtue, an ethics consultancy. And what I'm really focused on is helping senior leaders to operationalize digital ethics, whether we're talking about blockchain technologies or artificial intelligence or AR and VR. It's how do we help companies create processes, infrastructure, practices by which they can vet either products they're developing in-house or they're procuring from third-party vendors for various kinds of ethical risks. So, the way that I like to think about it is that when you talk about ethics and technology, there are sort of two sides of the same coin of ethics. There's the positive impact crowd. How do we go about creating positive societal impact? And then the other side of that coin is how do we mitigate risks, whether we're trying to create societal impact that we want to avoid pitfalls, or we're just pursuing, if you like, ethically neutral goals and we still want to avoid ethical pitfalls. How do we do that? And in my work, I tend to focus on the latter stuff. I tend to focus on how do we operationalize what you can call ethical risk mitigation, systematically and exhaustively identifying ethical risks. So that's what I do for Virtue. It's what I do in my capacity as a senior advisor to EY and on their AI advisory board. And, in preparation for all of this work, I was an ethicist. I was a philosophy professor for 10 years, writing, publishing, teaching on ethics. Some quite esoteric and some a little bit more, what you might call practical. Anyway, that's what I do, and that's what I tend to focus on.
Super. All right. Well, listen. Let's jump right into it. So I'm going to play devil's advocate on this first question, and ask you guys why is this important, right? We're essentially in the blockchain space. Why is having an ethical framework? Why is that important in the blockchain space? And I'll throw it open, and any of you guys can answer who wants to.
Well, I can start, particularly from a healthcare perspective. I know that the healthcare space is rife with ethical conundrums just in practicing medicine, especially in light of the recent pandemic and some of the stories that we've seen in the national media, where physicians have had to make some really hard decisions, ethical decisions on how to provision PPEs to people and how to prioritize who's sick and or who's sicker and who should be treated first and things of that nature. So when you lay on top of that quagmire of ethics consideration in healthcare, when you lay on top of that innovative technologies that operate in ways that are largely experimental and certainly new to the market, we're not really 100% sure of how the outcomes for implementing some of these technologies will round out over the course of many years because the technology is so new. It's particularly important for technologists, especially, and for those of us in healthcare, to have a keen eye on whether or not the technologies that we're using are appropriate, whether the use of them is equitable, if it has the potential to harm the populations that we want to serve, and so forth. It's kind of to Reed's point, mitigating the risk, and also the Hippocratic Oath. One of the primary tenets is do no harm. I think that the ethical approach to implementing new technologies like AI, like blockchain, like machine learning and things is what we're duty bound to commit to.
Yeah, and I can echo that. After spending 14 years in the healthcare industry and life sciences, so I used to be chief quality and safety officer and chief compliance officer and head of research in an academic center. And I can say it started with frustration, boots on the ground, because I felt that a lot of the barriers we encountered could have been mitigated if we just had a proactive, comprehensive ethics program. There is a lot of misinformation, a lot of miscommunication, lack of trust that could be addressed by having a solid ethics program. And specifically, blockchain, I felt, is one of the emerging technologies that's very difficult for people to grasp. So having a proactive ethics program combined with digital literacy efforts, I think, is what sparked my original interest. I don't know. Reed, do you have a broader perspective also that you've encountered in your
Yeah.
consulting work?
Yeah, I mean, so look, I mean, I take it. So the question, if I have it right, is why is creating an ethics framework important? And so I would sort of break it down into three separate questions, or at least three separate questions. One is why is ethics important? One is why is an ethics framework important? And then the third is why is an ethics framework important from, say, a business perspective or something like that. So as for what,
or from a blockchain perspective.
I'm not sure does blockchain have a perspective? Usually people have perspectives, or
People
businesses
have
have
perspective,
perspectives,
right?
or entities. Yeah.
Right.
So you see, that's already an ethical consideration. Is it a separate entity and identity or not? Go ahead.
Right, depending upon how it's defined. That's right, sure.
Well, I mean, I think of perspectives as something like, I don't know, a set of beliefs about what the world looks like, or set of perceptions about the world. And blockchain is a technology that doesn't have psychological states like belief and opinion, etc. So look, I would say that ethics is important because ethics has to do with human well-being and suffering, and human well-being and suffering are important, if anything at all is. A framework is important because it's the kind of thing that allows you to make progress towards achieving the goal of helping people, achieve well-being or avoid suffering. So frameworks are tools that we use. If I wanted to talk in fancy academic talk, I might say something about epistemological tools to help us know what the right thing to do is, or at least to not do the worst thing that we could possibly do. And then if you want to ask something like, why is having an ethics framework important from, the perspective of someone who's employing blockchain, say for nonprofit reasons or for business reasons, it has to do with not that are aside from don't do ethically bad things. It's that you're going to destroy trust when you start harming people, and that is going to do real damage to your brand, to your reputation. And since people usually appeal to blockchain precisely because of its ability to generate trustworthiness, by not taking ethics as a whole seriously, you're going to undermine one of the very reasons you decided to use blockchain in the first place, namely to generate trust.
And this is Marquis. If I could piggyback on what Reed just said, this is precisely why within the Healthcare Working Group for the GBA, we've decided to create an ethical design framework for blockchain in healthcare specifically. All of the points that Reed made, I share them. I think it's important that we mitigate suffering and we make sure that new tools, new paradigms that are brought into public use don't benefit one group or the other in a lopsided way, especially in a way that could victimize or minimize any one group. But we also believe, or I should say that I speak for myself, I believe that having an ethical design framework is important, particularly when it comes to healthcare, because I think it drives adoption. It's kind of like having it's like having guardrails on a new technology. It's giving new entrants to the space guidance on this is what you should look out for, and this is how it could work if you're not careful, instead of just relying on people to do their own kind of due diligence or their own training, however they decide to embark on that, to figure out what could be bad and what could be good.
Marky, let me jump in on that for a second. So I've got two questions, right? And I'm going to play a little bit of a devil's advocate in this conversation. So the first question is, why do I need a digital ethics framework? Can't I just tell people to don't lie, don't steal, don't hurt somebody, follow the 10 Commandments, follow the Golden Rule, and then
that works out really good when we do that in regular practice.
Yeah. Well, so the question is, what is it above and beyond that? Basically, those sort of basic statements, and why is that not adequate? I mean, clearly, I believe a lot of people would say that that's not adequate. But why is that not adequate? So from that perspective, let me throw it over to you first, Ingrid, and then Reed, I'd like to hear your thoughts on it.
So besides the sarcastic answer that doesn't work, the more comprehensive answer is that it has been proven over and over that there's so many facets within ethics, right? Data governance and all the other elements that are unique to technology deployment, such as making sure that we have privacy, integrity, transparency, diversity, accountability for all the work that's being done, not to mention making sure that we don't have biased algorithms. So all the facets that are important in deploying technology, in having appropriate data governance, they need to be addressed. And if you don't embed them in a proactive way and harmonize them with all the other elements that are essential for an organization to succeed and to be able to sustain their technological deployments, unfortunately, you have bad outcomes. And not everything is as evident up front. And only by having these deep ethics proven principles proactively, the way we like to call it, infused into the DNA of the organization. And when you deploy the technology into every single step of the process, I think that's what we've noticed works best. And it's also sustainable long term with and dynamically accommodating all the other future changes, as opposed to just doing it one time, doing one ethics project or one ethics, let's say, training, and that's not sustainable. So that's that's my opinion. But Reed, do you have additional comments?
Yeah, sure. So a couple things to say. Number one, you can't just say, don't lie, etc. Because that's not always the case. Sometimes you might need to lie, frankly. I'm not giving a particular context right now, but, so like if I put if I'm a real ethicist, I might say, look, if the dying person says that I live a good life and you think they didn't, you might say out of compassion, yeah, you lived a great life, right before they die. That might be the compassionate thing to do, is to lie. So there are certain situations in which what you might think of as a universal principle doesn't obtain. So that's the first thing to say. The second thing to say is that organizationally, and this is surely a point that Ingrid was highlighting, is that if it doesn't get embedded in process, then it gets at the very least overlooked because people don't raise the right questions at the right time in the right way. In the absence of a framework, even if those questions do get raised, people don't know how to address them. So then you have a bunch of ad hoc conversations that slow down whatever it is, overall efficiency. There's confusion, which leads to hasty and poorly made decisions. And then the other thing is that in the absence of a framework, you can not only can there be oversight, that is to say, you overlook certain kinds of ethical considerations, but you can build into process things that positively disincentivize you from doing the ethical thing. So most obviously, you can have financial incentives that incentivize people to do financially problematic things. If you have a framework in place that you've operationalized, then one of the things that you've done in creating that framework is you've looked out for those kinds of things, those kinds of obstacles that would prevent people from doing the right thing, and you've undone those obstacles in the process of creating and operationalizing that framework.
And like Marquis said, one more tiny point. Marquis mentioned another important point, right? Being able to give people the guardrails. I would add also that creating toolkits for people and risk analysis or a brief culture check to see what's their ethical risk within their organization also helps sometimes increase awareness and insight into what's needed. Sorry to interrupt. Yeah.
So, Marky, I'm going to come back to you on a question that's specifically relevant to ethical considerations when implementing blockchain solutions. But back to Ingrid and Reed, have you seen examples in your practices of sort of perverse incentives in healthcare where an ethical framework might have made a difference?
I can give a few. I don't know if Reed you want to have, but I can give a few where I'm not sure if I would use the same adjective, but definitely there are several examples where in healthcare with the best intentions, people really had only good intentions and still they created ethical conundrums. So for instance, if you try to create preventive early disease detection algorithms, and you put them on a blockchain. By not having these type of frameworks that we just discussed and guardrails or toolkits or everything we just mentioned, unfortunately, you can create a lot of bias. And although you might diagnose or prevent disease, you create also injustice and you might even cross over people's autonomy. So then it begs the question, okay, what comes first? So not to mention individual benefit versus society benefit versus global population health benefit. So there are a lot of facets, but there are endless examples. And I think this pandemic gave us plenty of examples.
Reed, did you want to cite any examples, and then I'll go to Marquis for the blockchain implementation question.
Yeah, sure. I mean, obviously, I can't get too specific, but there are cases where the ethical considerations ought to come into play, but people need to want to make decisions faster. And while I think that operationalizing ethics actually does provide overall efficiency, there are individual instances in which ignoring the ethical stuff and just moving forward actually is faster. And I've seen that happen, and that leads to ethically bad decisions, which leads to obvious problems. So that's one kind of example where there's a fear that it will slow things down, even though, again, I think when properly operationalized, there's an overall efficiency and safety that's added to the mix.
Right. Marquis, so I'm thinking about implementing a blockchain solution, right? Where does ethics, where does the concept of ethics come into? And then if you would touch even potentially on the concept of a centralized versus decentralized, because I know that that's a big a topic in the blockchain space. Wait,
yeah, centralized versus decentralized is a point that is visited. I'll tell you something that I've had a lot of pointed conversations about recently. Is it brings up the concept of data ownership, which has been a lightning rod in healthcare for as long as I've been paying attention. When EMRs first became kind of a requirement in healthcare for health services to be able to serve their patients, the concept that the data that about me that a physician writes in his progress notes or in his surgical notes, or that a nurse writes in her notes, or any professional that went to school for 8, 10, 12 plus years to learn how to diagnose and how to treat. There's been a convention of thought in healthcare that, hey, that data doesn't really belong to the patient. It belongs to the creator of the data. Whereas there is another school of thought that the people about whom this data has been created say, no, this data is about me. And in a lot of cases, I'm providing data to you. You're hooking me up to machines and you're reading my biorhythms and et cetera. And so this is my data. And so that has been a consideration that I've brought to the attention of several of the organizations that I've been working with. And this actually speaks to their cultural readiness to determine that the rights of the patient extend to their rights to own their data, their rights to be able to have their data portable and be able to share their data with whomever they want to. Maybe not this caregiver that wrote this particular op note about me, but maybe a physician that I will be seen by, in 2 years in, 5 states away. As far as the mechanisms of blockchain are concerned, it also brings up some very, very interesting points that I think healthcare hasn't had to really deal with. And again, this is all about the management of data. Look, blockchain is made to, in its purest form, to decentralize or disintermediate access to data so everybody can see through a common ledger the condition of data, the state of data, whether or not data is accurate, and so forth. And so it takes away the responsibility, or the need, rather, not the responsibility, because that's always in place, but it takes away the need for hospital systems, in the case that I'm using, to have a central repository necessarily. This could factor into how they budget their IT data governance protocols, and how they share information quickly and permanently with their patients, and so forth. There are nuances about how, to sum it up, there are nuances about how blockchain works and the permanency of the records that are, quite frankly, concepts that people in healthcare and in other industries haven't had to think about before. What if you create a note about a patient's condition and it's inaccurate, or it's outright wrong, or it's not for the right patient, and then you commit it to a blockchain and associate it with a person's record? Does it stay with that person forever? That they had this malady and it actually wasn't theirs. So these are some of the considerations that having an ethical design framework brings to mind in the developer and the adopter of these technologies. So they understand the kind of fire that they're potentially playing with, and they can make concessions for how the solution will work for them. If indeed it is a solution that works for their business case or their service case, and then how to create it so that it's as utilitarian as possible, and it mitigates the harm that it could cause.
Excellent. Reed, let me throw this next question at you. One of the things that Marquis just talked about was sort of ownership of data, right, and data privacy. So if I have a scenario where I have some patient information, right, and that data sort of belongs to them, but at the same time, that data would be important for, say, researchers or public health officials or other stakeholders, maybe insurance companies, right? How would an ethical framework, how would that help me decide which of those needs and rights sort of trump which other needs and rights? You're on mute, so you'll have to unmute yourself to answer the question. And how do we use an ethical framework to figure out those different sort of value perspectives?
Yeah, that's a really great question. So you're talking about situations in which something like the rights of individuals, or if not the rights, at least the welfare of individuals, can come into conflict with the public good. And this is, as you've noted, it's particular that sort of conflict is particularly highlighted in issues of healthcare, since healthcare issues are almost always about the public good, as well as individual welfare or individual rights. So look, first of all, there's not going to be some ethical principle that says something like this: you should always favor the individual over the public good. Right? We're going to find loads of cases in which that we think, no, that principle is just false. Similarly, we're never going to believe a principle that says you should always favor the public good, the privacy of the individual will be damned. No one is going to adhere to that principle either, right? So there is not going to be a formulaic way of just saying, always do this or always do that. And to the extent that we could refine such a principle, like always favor the privacy of the individual, unless X, Y, and Z, well, X, Y, and Z are just going to be the articulation of concrete cases where we've issued particular judgments about what the right thing to do is in those cases, how to balance in those cases. So this is just my sort of long-winded way of saying that in any kind of complex ethical conflict, you're not going to be able to answer that question by the simple application of some general principle, right? I want to take as an analogy the law. The Supreme Court exists precisely because you can't just take the Constitution and say, okay, Constitution says if conditions X, Y, and Z obtain, then it's permissible, legally permissible. If not, then it's not legally permissible, right? You have interpreters of the Constitution. You have people who debate over the Constitution and how to properly apply it to the case at hand. ethics and ethical deliberations are also like that. You can have sort of general guiding principles, but those principles will invariably come into conflict. And the only way you make reasonable conclusions is by working your way through those, through the reasoning about a particular case with other, intelligent, well-intentioned people.
Excellent.
So the framework is going to be something that will make sure that those conversations occur at the right time and in the right place, that the right kinds of questions are raised within those conversations, that the deliberations are guided by certain concrete, marks, principles, whatever, and that those decisions are documented in the right sort of way.
Yeah, and like Reed said, it's not as simple as thou shalt not and thou shalt. Nothing about the ethics conversation is really in black and white, is it? It's all about the nuances. It's all about how this scenario might be dark gray for this institution and light gray for that institution. Your mileage may vary.
Yeah, I think that's right. Let me just add one small caveat. So there are, in some sense, shades of gray, whatever that amounts to. But what I don't want it to amount to in people's minds is that it means that it's all just quote unquote subjective or just a matter of opinion. These are things to get right and wrong. You can engage in deliberation, get it wrong, right? A lot of people think that certain legal scholars, they just get it wrong. You can engage in ethical deliberation and you can just get it wrong. And you can also get it correct or justified and unjustified.
Let me leverage that over to my next question for Ingrid, because I think it's a perfect follow-on. So Ingrid, given that, right, there's no right or wrong answer. There's no formulaic, which I don't particularly like because I'm a very sort of
that's the opposite. Sorry, that's the opposite of what I said. While there are gray areas, there are still right and wrong answers.
No, I'm gonna get there. Right.
Yeah, sorry.
But what I'm saying is that there's no sort of math type of this is always right, that's always wrong kind of thing. So Ingrid, given that, what are the sort of structures? Reed talked about like the Supreme Court in sort of the U.S. legal structure component. What are some of the structures or components of an ethical framework that help organizations work through these ethical scenarios to get it right, like to get to that outcome that Reed was talking about, that actually was getting it right? What are the structures and mechanisms that a framework would include to help people get it right?
Yeah, well, there are some structures that are at country level, then there's some structures that are at an organizational level, and then within each organization, there are some structures that we recommend. And again, like both Reed and Marquis said, there's no perfect recipe, but from a structural perspective, I think we've seen that countries that have adopted let's say blockchain strategy, and within that whole blockchain strategy they also have a very clear statement on what that blockchain strategy needs to entail from an ethics perspective, and that includes a council on ethics. It's usually not one person, it's a council for all the reasons we just referenced. When you have work groups that are specifically focused on industries, again, because of what we just mentioned, that you need complexities and nuances to be adjusted to those industries, right? Retail has unique needs, healthcare other needs, tax and law other needs. So if we go even deeper within organizations, what has worked best is when we see that those organizations have a very clear ethics governance system in place, and that usually is also an ethics council within that group, and very close collaboration between key stakeholders to have an ethics governance group within that organization. And then of course we recommend in those ethics implementation toolkits to have certain elements are always welcome that we recommend, and again they're not going to be a recipe, but each organization should have a discussion about what their code of ethics should look like, what their bill of rights should look like, what their ethics policies, what their brand needs to convey from a principles perspective, and how would they want to create their ethics education program, and what type of ethics risk assessment do they want. So these are just a few examples when we talk about how do you conceptualize and formalize and create the infrastructure for an ethics framework. I think that's how I would structure it, country-wise, organization, and then within each organization, depending on the industry and depending on their scope, a little bit more in depth or a little bit higher level. So for instance, if you're a data company, as you can imagine, it's probably the most complex. If you're not a data company, you can get away with some of the basic elements. I don't know, did I forget anything, Marky or Reed, that you want to add?
Well, I think it depends on the reach of the organization. I mean, to Ingrid's point, government and large scale implementations have different ethical pitfalls, landmines that they have to navigate through. And as the organization gets smaller, the need to consider a broader scope of ethics might get smaller, it might not, but it all really kind of depends on the organization. That's especially true when it comes to healthcare.
Marky, I want to come back to that point after I ask this point, because I think you touch on something really important. Do different companies, different organizations, right, do they have different ethical standards? And if so, kind of peel that onion back a little bit. Does it make sense for companies to have different ethical standards? Do they have you observed them, and what do you think about organizations having different ethical standards? And any one of you can answer. And then, Marky, I want to come back to the point that you raised after that about what do you guys see as some of the major barriers to implementing ethical frameworks, and particularly in blockchain or technology solutions. But the first one is, do different organizations have different ethical standards? Have you seen any examples of that? What do you think about that? Anybody wants to answer?
So, Gerard, do you mean does one organization have two sets of ethics?
No.
Company
A have a different set of ethical standards than, say, company B.
Well, unfortunately, the answer is yes. Now, is that the right thing? No. But I think we have to define what do we mean by ethical standards. If we and Reed is probably the most optimal one to provide that answer. But unfortunately, this is, I think, what we're trying to mitigate. We do not recommend different standards. Ethics is ethics, like Einstein said, right? Relativity applies to physics, not to ethics. So I would reframe that question to say ethical principles have been the same since many centuries. I think what we would like to emphasize, I hope, is that the implementation and the cadence, the degree, the depth, everything else that we talked so far should be different. But ethical principles have been the same and will likely stay the same.
So Reed,
That's mine.
Is there one sort of ethical objective reality?
Yeah. Okay. So that's a very question, right? So I'll give you my view on this, I suppose. So, who else do who else do I give, I suppose? Let me give Marquis' view on this. No. Okay. So, look, I think that the following is quite plausible. This is, the real philosopher talking, where I'll say what's plausible instead of committing myself to a particular proposition. The following strikes me as quite plausible. There are a set of ethical guardrails that universally obtain. That is to say, there are some set of things that it's just wrong to do. Slavery, rape, genocide, I don't care where you are or when you are, it's the wrong thing to do. Okay. Incidentally, that issue should be separated from issues of blame, like whether everyone is to blame for doing all those things or whether there are ever mitigating circumstances, like, well, everyone was, everyone had slaves. And so does that mean that they're no longer to blame? That's a separate, more complicated question, but nonetheless, they were doing the wrong thing. Okay. There's then a question about, well, so there's the realm of the impermissible, which arguably is fairly universal. There might be caveats to that. And then there's the realm of the permissible, and there could be lots of variance within the realm of the permissible, the ethically permissible. right? So, and this speaks to whether different companies can have different ethics. You might think that they all have different ethical guardrails, right? Things that none of them should be doing. None of them should be helping people engaged in child sex trafficking, for instance, right? That said, within the realm of permissibility, they might be quite ethically different. One might be within the guardrails and have a huge emphasis on privacy. They really care about privacy. Another one might really care about mitigating suffering of people. So they're sort of led by compassion more than they are a concern for something like property rights or something like that. So there's lots of, just as individuals can be all ethically, a variety of individuals can be ethically acceptable, but have sort of different ethical preferences for what they emphasize in their lives, so too can organizations fall within of the same set of guardrails while still being pretty distinct from each other, right? So you might think that the life of a monk is ethically acceptable, and it's very different from the ethics of, say, an activist. You might think that's ethically acceptable as well, but it's
Reed, let me. So earlier you talked about the example where you've got a patient dying and they ask, "Did I have a good life?" And you say yes, right? So that would seem to indicate that the ends justify the means, right?
Well, no. Well, it means that there are cases in which the ends justify the means. It doesn't mean that in every case the ends justify the means.
Or more to the point, that the ends you might rationalize that they justify the means, but do they?
Right, and that goes back to the structures and that Ingrid was talking about, to contextualize all of these things.
So in that case, what you might do though is here's like a very quick snapshot of what that reasoning might look like. Okay, so look, why is lying typically wrong? What typically makes it wrong? Well, that kind of deception leads to them making bad decisions down the road. It's a failure to fully appreciate their intellect or respect their intellect. It's blah, 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 blah. And then you might say, well, in this case, though, we're not worried about, for instance, her inability to make further decisions, and the lying would impair her ability to make those well-informed decisions because she won't be making any future decisions because she's about to die, right? So one of the things that makes lying wrong in standard cases isn't present here. And then you can keep going. What are the other kinds of things that make lying wrong? Does it obtain in this situation? Or are there other overriding features that make it, are those wrong-making features, if you like, not present in this case? And even if they are, might they be outweighed by other circumstances that usually aren't present? For instance, the impending death of a person. That changes, right, if you like, the moral ingredients of the case.
So the framework that you guys are working on, really, and the toolboxes and these things really are sort of a structured way of analyzing issues to kind of peel the onion back, get to the root cause to make a good decision. Is that a reasonable description of it?
Potential issues, yeah, sure.
When I talk about a framework, I would distinguish between something like structure and content. So the structure is going to be about how we're going to sort of get these questions raised. Where do they get raised? How do we educate people? How do we train people to sort of standardize approaches to things like informed consent in the healthcare industry? How do we get people to smell ethical smoke when the standard approaches might not work? When they smell ethical smoke, what's the process by which they elevate those concerns? To whom do they elevate it? What does that deliberative body look like? How do we decide who should be on the deliberative body? What's their jurisdiction? What powers do they have? Blah, 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 blah. Right? And then there's the content of the actual decisions that get made and why they're made. And that's a different issue, where the framework will, by necessity, only be able to provide the roughest of guidance, because the actual content for particular cases will have to be the result of decisions made in concrete circumstances.
Wow.
And Gerard, I would like to make one more point that goes back to your original question: do organizations have different standards? In our encounters, and I think Reed and Marquis might echo that, but it's very often the case that you see three big buckets. We're cutting out organizations that intentionally do bad things. We're not discussing those, but those that we assume want to do only good things, have good intentions. They sometimes have a beautiful piece of paper that might be 80 something or 100 something pages long, and it might be beautifully written, but it was never actually deployed or implemented in a meaningful way. Then you have others that have nothing, and they just remember that there was a department once in a while or a human once in a while that said something about ethics, but they have nothing in place, not written, not implemented. And those in between, which are quite a lot of them, where they might have various forms of written documentation, but certainly very inconsistent ways of deploying it. I think through our frameworks, what we're trying to emphasize is that there is a proactive way to approach all these things and good questions to ask and do a thorough risk analysis. And then there are certain, yes, toolkits that can help people that want to do well ask as many questions as possible and think about all the possible scenarios so that whenever society and the technology allows, you are encouraged and given the tools to do well. I know it's a more long-winded answer, but that's our most frequent problem that we see, the bridge between written intent and then being able to deploy all these ethical elements.
So that leads us right into the next question that I want to ask you all, and that is, and let me tell you a story first. So I was invited to Cameroon to meet with the ICT minister, and I think the president had just won re-election. I think he'd been the president for 38 or 40 or 50 years, something like that. And she said to me, "We're interested in blockchain applications in all of its use cases, except for elections. Our election system works just the way we like it, right?" And so I tell you that story as a preface, right, to what are some of the challenges or barriers that you each see in deploying ethical frameworks. And so I'll just go down. Let's go Marquis, Ingrid, and then Reed.
You said some of the barriers?
Barriers, yeah, to deploying an
challenges,
yeah.
So, that is a good question. So I view a framework. The concept of frameworks is not new in a lot of industries. We've got software developers that use frameworks. We have frameworks for building buildings. And in these frameworks, we have a slew of tools that you could peruse, and you might need some of these tools and you might not need some of these tools, and your mileage may vary, kind of like we see it, what we said. But to what Reed was saying, there is a right and a wrong way to build a house, for example, right?
What do you think? What do you think the barriers to building a framework would be?
So insofar as, I'm kind of getting to that. I'm a little long-winded myself. Insofar as frameworks are concerned, depending upon how comprehensive the framework is, how many different tools and how many different perspectives for entities that might not think that they need to go into all of the depth that, for instance, the framework that we're building for ethical design of blockchain technology in healthcare, a small practice might look at the entirety of the framework and say, "Oh, we don't need to be this complex." So I think that education on the need for ethics is something that really needs to be we have to get after educating people that the ethical approach to anything that you're doing in healthcare, particularly with technology, is important, regardless of the size of your enterprise.
Great. Let me go to Ingrid, because I don't want you to take all their thunder. So what I'm just going to summarize what you said, that some people may not perceive the need or the value, or they may look at it as a lot of administration and overhead without an adequate return on investment, and that education is a key to that. Is that an adequate summary of what you just said?
Well, more to the point, what I was trying to get at was people need to be educated as to how the ethical question of using these technology applies to them. Not that it doesn't, because, hey, you have all of this whole list. We don't need that whole list. You might not need the whole list, but you still need to look at what might be suitable for you. So ethics is important to your group, no matter how big the size. Yeah.
Right. Got it. Ingrid, What do you think are some barriers or some challenges in implementing ethical frameworks?
Well, I think you alluded to a big one that in multiple roles I have that are global, right? The discrepancy between what we're sometimes aiming to achieve through ethics frameworks and the legal landscape or the regulatory guidelines, it creates a very complex web to navigate for a lot of C-suite leaders, right? It's very difficult for them to integrate the three, so the legal, regulatory, and then the ethics frameworks. The second part is, I think the one that I've encountered in most organizations is that everybody wants to do ethics as a sidekick at the end, instead of understanding that it has to be proactive and truly, truly synchronized and harmonized with everything else that happens in that enterprise. So to your earlier question at the beginning of the podcast, when you're ready to deploy blockchain, ethics should always come first as opposed to last. You need to think about these things before you even design your blockchain strategy. And I've seen that across the globe. The third, I would say, which is related to Marquis' education thing, I would just say ethics education. People don't even understand what ethics is. And I don't mean to criticize. I'm just saying we need to start with that. We need to educate everybody what is ethics, because how can you even implement a framework if you don't understand the basic concepts? So those are the biggest that I've encountered globally: legal, regulatory, education, and where it belongs at the beginning of a process instead of at the end as a, oh, we forgot about that, let's just do a little paper. Yeah.
Oops.
Reed, anything you want to add to that?
Yeah, well, one thing I want to add is that with blockchain, it's particularly important to get it into the beginning, precisely because it's so damn hard to change any of it after the fact, right? So it's immutable for one. That's an issue, and then changing the rules of the game is phenomenally difficult once it's already started. So if you don't bake it into the beginning, good luck trying to bake it in later. It's a little bit easier with things like machine learning, but blockchain. Things are so set in stone early on that if you don't get it right early on, it's a massive obstacle to fix down the road, and it might not be an overcomable one. As far as the obstacle to getting people to build frameworks and operationalize them, I'll say two things. One, to echo Ingrid, which is that people don't know what ethics is. They think of it as subjective. They think of it as quote unquote squishy. That I've heard a number of tech leaders use that
fuzzy or
fuzzy, and if it's all squishy and fuzzy, then what the hell are we actually talking about? How are we supposed to think about it? How are we supposed to make decisions based on something that's essentially squishy and not concrete? Now, I think that's the result of not really understanding what ethical deliberation and inquiry and decisions actually look like, and how ethics, as it were, works or operates. And if people understood that, then they wouldn't see it as squishy and fuzzy. They'd see it as something, as a set of concepts that are extremely useful for solving real problems. And then the very last thing I'll say in terms of an obstacle is that people are not clear on what the bottom line ROI is. I think that a lot of people want to do the right thing. They, at the very least, don't want to do the wrong thing. But if you're in an organization that doesn't support it, and it doesn't support it because it doesn't see how it connects to the bottom line, then it makes it very hard to create the framework in the first place, to operationalize it, which requires getting the proper buy-in. And so one of the obstacles is that people don't see a close enough link between ethics and an ethics framework and operationalizing it on the one hand, and bottom line ROI on the other. And I actually think that there are a number of ways to draw that line, especially those around reputational risk, brand risk, et cetera. But until that connection is seen, decisions won't be made to take it seriously.
Got it. Marquis, what I'd like to do is, you're the lead of the GBA Healthcare Working Group, right? Talk to us a little bit about what is the GBA Healthcare Working Group doing? Where are you guys going? Maybe you can kick that over to Ingrid to talk about the deployment of the framework or whatever, and then I know you got some other projects down the road. So actually tell them what the GBA Healthcare Working Group is.
I was going to start that way. That's perfect. Probably the best way to do it. So the Government Blockchain Association is a consortium of networked professionals, enthusiasts, technologists, innovators in the blockchain space globally, the Healthcare Working Group concerns ourselves with specifically those professionals that have a healthcare background, are in the healthcare space, are lovers and purveyors of all things healthcare. So we have a membership right now. We're currently at about 55 or so people, and we have regular meetings where we look for ways to be of service to the blockchain community as it relates to healthcare. There's a dearth of information about blockchain and its usefulness in healthcare. And so we take it as our responsibility to help to educate and to help connect professionals with other professionals for a myriad of different reasons, as you can imagine. So the current project that we're working on, again, in an effort for us to provide value to the space, back in January, we had a Future Money of Governance and the Law symposium at the Capitol. The GBA had this symposium. It was very well attended. And after speaking to a few people from the Healthcare Working Group that actually made it out to the meeting, we talked about the occurrence of the question of ethics in innovations. And as we were kind of talking it out, me and some of my colleagues in the Healthcare Working Group, we decided that it would be a really good and useful idea for us to create an ethical design framework for blockchain and healthcare. So we've been at it from about mid-February, and we had some slight setbacks on our timing because of the impact of the pandemic on everybody's lives. Everybody had to kind of adjust their schedules. Again, we're talking about professionals all over the world. But we have started in with our framework design by, the first installment is our white paper. And the white paper really kind of illustrates and frames out what the framework is for, who the audience is intended to be, and basically some of the critical points that we wanted to touch on in the framework. We are looking to publish the white paper aspect of the framework by the end of the third quarter, beginning of the fourth quarter.
So in case anybody listens to this later, end of second or third quarter
of 2020.
2020.
So since this is September, that's in about 45 days or so, we'll have the white paper published. And then myself and my compatriots who have been contributing to this effort are going to go about the business of really framing out all of the points that we touched on in the white paper and creating some of the toolkits that Dr. Ingrid was saying are useful in a framework kind of resource. So, creating templates, giving really the audience food for thought. What should you be thinking about if you decide that blockchain technology is useful for your business case? What do you have to think about after that? So how do you go about implementing this solution without causing a whole lot of risk and achieving the greatest benefit to your organization? So that's what we're working on right now. We plan on having the actual framework completed sometime, hopefully, early in 2021. And then from there, we have a couple of other projects that we are considering kind of in the hopper, if you will, for our resources to start attacking. Not the least of which is an interoperability token that healthcare users or healthcare solution developers and utilizers can use for connection to other blockchain solutions. But this project that I'm speaking about is still in its kind of inception phase, and there's still a lot that we have to really determine about the direction that we want to go. But we have regular meetings, and they're typically on Thursday mid-morning East Coast time in the United States. You can join the Healthcare Working Group if you are a member of the GBA by going to gbaglobal.org and following the links to the Healthcare Working Group. And for those that might be listening that are in the healthcare space, that are interested in blockchain or are blockchain professionals, technology professionals, want to learn more, we'd love to have you. We'd love to get your input and feedback.
Awesome. And we're going to put the contact information for all of our panelists today in the show notes so that you'll be able to reach out to them. And relative to that, Ingrid, Reed, and then Marquis, I want you to finish this sentence for me. Contact me at the information in the show notes if you ... So if Ingrid, if somebody wanted to connect with you, what would be some reasons for them to connect with you? And then Read the same thing with you, and then Marquis, you can add on if there's anything else you want to add. Ingrid.
If you're interested in designing your blockchain strategy and have a proper ethical framework that accompanies that, please contact me via LinkedIn. You can find me or on Twitter or on Instagram.
Excellent. And then we'll put all of those handles and links in the show notes. Reed, contact Reed if you ... Yeah,
if you're looking to think through how to operationalize ethical risk management in your blockchain product development or deployment or both, I'm the person to help.
Awesome. Marquis?
Contact me if you want to collaborate, if you want to brainstorm, if you want to just vent about technology or healthcare causes that are important to you. I'm really enthused with building communities using some of these new innovations. So if you're on board with that, I'd love to speak to you.
You forgot the most important thing, Marquis. Contact you if you want to eat Indian food.
Oh, yeah. If you want to eat Indian food, I'm your huckleberry. And I actually have some pretty good recipes for chana masala as well.
Awesome. And then just in terms of that, Ingrid, you're down in Florida, I think near Miami, right? Or Orlando?
In Miami, in the middle, yes. Okay. But I consider myself a global citizen.
Yeah. Reed, I want to think that are you North Carolina or where are you located?
No, I'm in Brooklyn, New York.
Brooklyn, New York. Okay. Excellent. Well, guys, thank you so much. It was an exceptional panel. I know I learned a lot. Again, we're going to put tons of information in the show notes. And if anybody's interested in the Government Blockchain Association, like Marquis said, it's gbaglobal.org. And we'll have that information in the show notes as well. So thank you guys all very much. And I look forward to talking to y'all soon.
Fantastic.
Yeah, thanks so much. It was really fun.
Hey, guys. Thanks for talking.
We shine the spotlight on our community. Please take a few minutes and listen to one of our global members.
The future of money governance and the law is brought to you by the Government Blockchain Association, or GBA. The podcast brings together leaders in the public and private sector to discuss how government and industry can work together. We talk about how to enhance the integrity of our institutions and the quality of life for the people they serve.